All right, let's begin by giving you a quick update on what's happening with COVID-19 across the country. The overall India cases have dipped slightly over the last few days. So if I just look at the 3 days, 16, 17 and 18 Jan, we can see a dip coming in from 2,71,000 to nearly 2,38,000 in the latest 24-hour cycle figure. Mumbai and Delhi continue to see a dip as well. Delhi's new cases are down to 11,684. The number that came out today. Mumbai's cases also see a significant dip down to about 6,149 cases. Now, test positivity rates still continue high, at least in Delhi. Official testing numbers have also come down, leading to fears that the availability of self-test kits may be masking the actual number of infections, because people are using those kits don't necessarily have to report them. Meanwhile, cases are going up in some parts of the country. Bengaluru and Assam are now reporting higher cases than before. But the story that we're tackling today is one of vaccine mandates. So we know that the perils and the journey of tennis star Novak Djokovic has had the world enthralled. Now he may be cut out of the French Open as well after the huge fracas in Australia, simply because this sports star doesn't believe in vaccinations. At the end of the day, that's the bottom line. He doesn't want to be forced to have vaccines, and it has now raised a cloud over what his tennis career will look like. One way or the other, vaccine mandates are kicking in around the world. In India, the debate actually reached the Supreme Court because of a petition that was put in, and in the hearing, the centre made its position clear in the top court, saying that it is not enforcing vaccine mandates of any kind. That means you don't need a vaccine certificate for any official purposes. Nevertheless, if you have to enter a private space in any top city today, a mall, in some cases a restaurant, public transport, you will need to have 2 vaccinations in place. The question we're raising today is truly a tricky one, and it would be wrong to say that there is a clear yes or no answer. On one hand, everyone says that you shouldn't force people to get vaccinated. But is there scientific reason to believe that a number of people unvaccinated because of their free will could harm society at large? Should the question of vaccination be treated as one of free choice? To discuss this today, I'm joined by Dr. Chandrakant Lahariya, epidemiologist and vaccinologist. Dr. Ramanan Laxminarayan is joining us today. He is the director of CDDEP, and I will also be speaking with Dr. Soin in just a bit from now. Dr. Ramanan, let me begin by getting your take on this debate. As the world grapples with the question of vaccine mandates, do you think it makes sense to enforce this so that the larger public is safe?
You know, that's a great question, and it is not a straightforward answer. There are some that would argue that forcing people to get vaccines makes them nervous and therefore less likely to want to get vaccinated. But on the other hand, requiring vaccination for things like international travel has always been, the truth. And, this is not something that is new. In many countries, even to enroll a child in school, you need to have their vaccinations be completed. We don't necessarily have those rules, across India, but I think the idea that vaccinations are in the public good is very well understood. Now, we have seen during the Omicron wave that vaccination is not necessarily something which prevents transmission of infection or even being infected, but what we do see is that vaccination does prevent severe disease, which then reduces the probability of transmitting to someone else. It also is helpful in terms of reducing mortality. And from an overall public health standpoint, I think it's very hard to argue against vaccination now. The benefits, far outweigh the costs. Now, the question is whether we should leave that decision in the hands of individuals, or whether there should be some sort of a community approach where you say, listen, if you want to participate in the public space, you have to get vaccinated, which is what most of Europe is now doing. That was the grounds for Australia rejecting Djokovic's application to play in the Australian Open. But I think more importantly, it's a question of a signal. It signals to everyone that this is something which is really, really important. We're dealing with a war situation in a sense, with an unprecedented pandemic. And I think if it were, a seasonal influenza, for instance, you might say, well, you can decide whether you want to get vaccinated or not, even though influenza is also transmissible. But I think COVID is a completely unusual circumstance because the cost of COVID continuing is that people get hospitalized, it creates panic, people dying of it, which then brings down the entire country. So I think as an exception, it would make sense to require vaccines to be provided for anyone who wants to be in the public space. Of course, if you want to only sit at home and not go anywhere, then perhaps you shouldn't be forced to get vaccinated. But I think to participate in the public space, whether in trains or buses or being in a supermarket or anywhere else, I think a vaccination mandate is reasonable given the circumstances.
Okay, so you are essentially for a vaccine mandate. Dr. Lahariya, what is your position on this?
So the issue of vaccine mandate or mandatory vaccination is as old as the start of the vaccination across the world. It's 2 centuries old, and people have always argued whether vaccines should be mandatory or not. But to answer this question, we need to understand that vaccines have both individual benefit and public benefit. So especially in the context of COVID-19 vaccines, we know that those vaccines prevent from severe disease, hospitalization, and death. So definitely there is a very good, strong case of individual benefit, and people should get vaccinated at individual level. But when it comes to public benefit in terms of reducing the transmission of disease by COVID-19 vaccination, the evidence is not very clear. What we know that mRNA-based vaccine definitely reduce transmission. There is a scientific and proven evidence. But when it comes to other vaccines, as an example, the Covishield or Covaxin, we don't have studies that these vaccines reduce transmission. Now, going by immunology, we know that if someone develop antibodies, it is likely to that some reduction in transmission would happen, but we don't have a quantifiable number of that transmission. Theoretically, some reduction. So the public benefit of COVID-19 vaccination is limited, individual benefit is higher. That's one part. Second part is that what we need to remember that vaccine mandate, even historically, we need to separate essentials of life and non-essentials. So of course, some restriction on going to the public place or a concert or bar or restaurant are reasonable in such challenge. But can individual be denied essential like a salary or a food or a train journey, which is essential part of life? That is again debatable. So putting these two things together, individual and public health benefit and essential, non-essential life, I think this discourse is going to be very specific to different settings, like countries which are using a proven vaccines with a proven benefit on reducing transmission are more have a legitimacy to put restriction rather than other settings. But we also need to factor in epidemiology, we need to remember, and this pandemic is epidemiological or public health challenge, and in epidemiology, context matters. So what is applicable for Australia or France may not be applicable for South Africa or Kenya or India. So I don't think a simple answer is there, but I will summarize this way, that there is no clear mandate that vaccine should be mandatory for all population, all setting. A local decision can be taken. But no matter what, even historically, even the case of mandatory vaccination rule, the final point is that there are always exemptions that individual who is not willing to get vaccinated will be exempted on philosophical, scientific or belief ground, and they will be left out giving counseling, but they have a right still, even in mandatory vaccination, individual has a right to deny.
Okay, so right to deny. Let's come to the crux of the matter. Should you have the right to deny vaccines? And it should honestly, we have to look at it clubbed with other public safety measures. Dr. Soin, great to have you on this debate. Now, if you compare this, you say, not being vaccinated is bad for your health. There are a lot of things which are bad for an individual's health, which they are allowed to do because they are free to exercise their choice to, do things that are bad for their health, whether it's smoking, drinking, eating junk food. Some may argue that why force people to vaccinate if they have a strong belief they just don't want to?
Okay, now let's take the point that you're making. Quite apart from COVID, positive health behaviors are rewarded in many places. And what's a positive health behavior? That's not smoking, not drinking excessive alcohol, even not eating healthy, not eating unhealthy food. So I think positive health behaviors actually create a positive impact on the health of the society, and they should be rewarded, and unhealthy practices should be discouraged. So that's as far as I would go with your example. Now, the COVID situation. Let's look at it practically. For all travel, you need vaccine certificates. For all public places, you need vaccine certificates. For workplaces, you need vaccine certificates. Certainly for hospitals and healthcare facilities, you need vaccine certificates. I mean, there are very few people in the world who can say that I'm going to sit at home and not interact with anybody else and not go to any public space. So that's not really happening for most people. So you, practically speaking, you do need to get vaccinated. Now, let's come to the personal and public benefit of vaccination. You certainly get less infections with vaccination. There is no doubt. There is like hundreds of studies showing that. Okay, there is less severity in the infection, even if you get infected. So if you get less infections, and even if you get infection, you get less severity of infection, then obviously it's of benefit to yourself and to the people that you interact with. Obviously, the healthcare facilities will not be overwhelmed if there are people with less severe infections. So that's a benefit to society. And obviously, if you do not get infection, you will transmit less. So I'm surprised that the epidemiologist felt that the public benefit is not clear. I think it is pretty clear that if majority of the population is immune to the disease, either through getting the disease or through getting vaccinated, there will be herd immunity with, what we've been talking about for the last 2 years. And that's definitely public benefit. Aren't we all wanting to end the pandemic, and isn't herd immunity the only way to end it? Yes, the virus will get exhausted if most of us are immune. So there's public benefit in vaccination. So I think that it's pretty clear that even though the government may say that there should not be mandatory vaccination for practical purposes, everybody needs to get vaccinated.
No, so let me get Dr. Lahariya to respond to that part, because at the end of the day, that is the biggest question in the whole debate. Does an individual choosing not to get vaccinated harm not just themselves, we know it would harm themselves, but does it harm the public at large?
So the first point I want to make is that I fully support the vaccination in a voluntary manner. Like everyone should get vaccinated. That is a universal principle. The vaccines are proven tool and they prevent from severe disease hospitalization. The only question is that do we have an answer of whether vaccination should be mandatory in a black and yes and no? The short answer is no. It is not that simple. Regarding the public benefit is concerned, undoubtedly there is some public benefit, but how much is that is not quantifiable. It appears with the COVID-19 vaccines very limited. Otherwise, what is the reason that there are populations which are fully vaccinated, but infection is still happening? So public benefit is preventing infection in the community. And the COVID-19 vaccination, there are many population groups which have received 2 shots, 3 shots, and even then benefit. Those populations are having high rate of transmission. So reducing transmission is undoubtedly not something which we can link with the COVID-19 vaccine. But definitely that does not mean reducing transmission is the purpose. Purpose is preventing severe disease hospitalization, which vaccines continue to have. But then it comes to the another dimension, which is a key, like in India, wherever there has been a coercive approach. Go back to 1977 or 1975, when there was a coercive approach to family planning, and it resulted in the future for next 20 years, the entire family planning program suffered. So globally, there is no history that when you put a force or mandate something on people, it affect the long run. We should not be aiming for COVID-19 vaccination as a short-term measure. This is going to be long-term approach. People would require in the future also repeated vaccination, especially some subgroup. So doing something in the thinking only short-term measure might be harmful in the long run. And we know the fraud and other things where people, if it made mandatory, it will not be difficult for people to get those kind of certificate. We know people have got COVID-19 certificate, test certificate, which were fake. So we need to keep a balance. And in the public health program, it is always participation. Yeah. communication and engagement with people rather than making it mandate, which can really backfire. And COVID-19 vaccination is a long haul.
Okay, no, absolutely. I mean, I don't think anyone would propose forcing people to do things. But, you know, Dr. Ramanan, you said at the beginning of the show that COVID is the exception. COVID is the exception because of the huge disruptive impact it has had on the world and everyone's lives. So at the end of the day, the question, I suppose, is that if a few people choose not to get vaccinated, will it prolong or not let the whole COVID-19 cycle end? Is there scientific evidence to that?
Well, we now see that the vast majority of people requiring oxygenation or on ICU beds are people who've been unvaccinated. I think the difference between those who are vaccinated and those unvaccinated in terms of the toll on the healthcare system is quite significantly towards those who are unvaccinated. So I agree with Dr. Lahariya's points. All of them are absolutely spot on that typically, forcing people to do something is never a good idea. But I don't think mandates mean forcing. Your question was, would vaccine mandates be essential? That doesn't mean that you drag people off to a sterilization camp that happened for family planning. I think if you just say that, listen, to board a flight, to board a train, to be in a movie theater, to be in a mall, to be in a public space, you just need a vaccination certificate. So you're not forcing anyone to go get vaccinated, but you're effectively excluding them from public participation because they don't have a vaccine certificate. I think those are two very different things. And I think we can encourage people, nudge them towards vaccination without being coercive. And I think that's, if we adopt that path, I think the one truism is that COVID is not going anywhere. We will have to vaccinate against COVID likely multiple times in the future. We're not done with that. So we do need to get people to get on board with the vaccination program, but we need to make it, something that they consider, it's a routine. It's something that they would happily get onto. And certainly for that reason, we don't want to make it, coercive, but we can encourage.
No, so this is again the interesting point, and where it comes down to vaccine mandates. Let me come back to the example of Novak Djokovic. He doesn't want to be vaccinated, but not being vaccinated could effectively end or hamper his tennis career. So it's a large price to pay. Dr. Lahariya, what about those kind of mandates? And let me give you another example with it. For example, the mandate to wear a seatbelt. If you don't, you could be prosecuted with very large fines. Do you think that there is a parallel there to be drawn?
So I would go back to my original point that, of course, as a public health measure and to nudge people in a particular good behavior, like incentives or disincentive had to be there. And that is a very standard approach. But then I would say that there are few things which are essentials of life. Like no one should be denied salary or job based upon whether they are following that seatbelt measure in a car or not. People say that we know that jumping a red signal is an offense, but that is not counted in many of the public health or essentials of life. So what we need to do that while Novak Djokovic has made a choice in this thing, but it is definitely not easy that it's whether what Australia had done the right thing, but he has made a personal choice. How much he should be denied on basis, that is going to have to be debated in many months and time ahead. But what we need to remember, a public health measure to incentivize a good behavior which is considered right is a good approach. But how much we can disincentivize, that is going to be a local call, a call by the country, and that need to be discussed by the experts on a regular or changing context basis.
No, so at the end of the day, it will become a legal question. Dr. Soin, like for example, if private employers, and many of them right now are insisting that if people have to come into office and work and continue to work, they have to have 2 vaccinations. So if you're an employee with a top company today in India and you for some reason don't want to be vaccinated, it's going to be difficult to hold on to your job. That's a threat to your right to employment. Now on issues like that, which have a legal constitutional base, how do we move forward?
Well, I think I'll restrict myself to the medical comments. And there I would say that if you are not vaccinated with the COVID vaccine, and if you're working in a factory or if you're working in a healthcare institution, or if you're in a crowded place where 1,000 people collect, you're actually not just harming yourself, you're also a risk to society because you're more likely to get infection, you're likely to get severe infection, you're more likely to transmit it. So at some point, individual preferences should be, what I mean is that public responsibility and social responsibility should take precedence over individual preference. So you may go to court saying that, I was dismissed from my job because I did not get vaccinated, but there is a counter argument, which is that you're actually risking the other people working with you. So I'm not an expert in the legal matters, but I think it is your responsibility to society to make sure that you continue positive health behavior, and getting vaccinated is another example of positive health behavior.
It's a debate that is truly ongoing, even as India covers its vaccination goals at a very rapid state. The fact remains that many people still are in two minds. Can they continue to be? It gets even trickier when it comes to children. Should there be a vaccine mandate for children going to school? There could be some parents who are not very sure. It's murky waters yet, and one that we will have to navigate carefully. At the end of the day, I think the common goal for everyone, whatever they believe in, is to end the pandemic. And that perhaps could be the starting point. Thank you so much to all of you for joining us in the discussion this evening.